Yeah, I'm Jason Buglass. I set up Dentale about a year ago in its present form. It was based on a series of courses that would run for the past 10 years. The primary feature about the courses that the dentists seemed to like was the amount of practical experience they got, and it culminated in them treating a patient. Now, dentists like the practical side of things, and the ultimate practical experience is placing an implant in a patient. So the more of that treatment that they could do, the better. So we devised a further course then, which went on from the original week-long course, which allowed the dentist to practice on many patients, following through the treatment planning right from the planning and then to placing the implant and then restoring the implant. So they followed the whole process all the way through. We try and produce an environment which is as close as possible to the normal workings of a general practice, so the dentists are familiar with it. The problems that arise as a result of that are all there as well, so it's normal day-to-day life for the dentist, and that sets them up much better at the end of the course for taking the training that they've had out into practice and applying it in their own practice. So we've set up two different types of courses. One is really aimed at dentists who know experience at all of placing implants. Now, inevitably we have to include some theory in this. We have to go through the necessary core knowledge. It gives a basic understanding of the theory that's required. The dentists are going to have to do some more reading to acquire further knowledge. Most dentists don't like sitting in a lecture theatre listening to lectures, so we do minimise the lecture content as much as possible. The learning appears to be better if people interact, and we do various hands-on sessions where they can work out the treatment planning for themselves. So during that week they will have practical sessions on plastic models, on plastic mandibles, on pigs' heads, various different sessions, revision of suturing techniques, fetching people back up to speed as to all the techniques that they're likely to need. At the end of that week they will then place an implant into a selected patient. Now, we carefully select the patient to make sure it's a nice, straightforward, easy case. Not many of the cases are easy, so it's helpful that they've been sorted out. Allocate that case to the dentist, and then the dentist places the implant. And it's the process of actually placing the implant and doing it themselves which gives people a real buzz. And at the end of that week, everybody's mad keen to get going. But a lot of people want some more of that experience. So we devised the 10-day course, which really is almost entirely practical based. We might have tutorials in between times on an ad hoc basis. Teaching ratios are extremely favourable, 1:3 or 1:4, and it's really just treating patients. So diagnosing, following the treatment plan up, initially placing the implants, and then restoring the implants later on. The patients are organised. We've had to develop some fairly sophisticated systems for managing the patients to make sure everything is in order, but everything is documented for the dentist so that there's a very comprehensive record kept. This record is then developed into a logbook, so that one of the requirements that the GDC would like to see is evidence of training in effect. So using this comprehensive logbook, it's possible to show that you've had adequate experience of placing implants to be safe. The supervision is constant, but you're allowed to stretch your capabilities. So there is a backup, there's a safety net, so you can push things a little bit further and do things that you perhaps wouldn't want to do by yourself in practice. It's a much more effective way of doing things than the alternative, which is a mentor-based system. There are inherent practical difficulties with that, where the dentist has to go to another practice, the mentor perhaps has to go to another practice, even worse, the patient has to go to a mentor's different practice. It becomes complicated. Here, everybody's brought together in one place, the patients know exactly what's going on. That single advantage alone is worth it, because the patients are aware that the dentists are training, they're quite happy with that, they accept that, that's part of the terms, and so it releases the dentist from that pressure to perform as if they knew exactly what was going on. It's quite okay to ask the tutor what to do. And on top of that, in the unfortunate event that things don't turn out exactly as planned, the tutor's there to intervene and sort the patient out so that the patient doesn't come to any mischief. The whole organisation here has been developed over a period of a year. it's taken quite a lot of effort to overcome many of the problems that have arisen. It's not a straightforward thing to organise. The key to it is having an excellent staff. We're very reliant on the staff. The nurses, they have all had extensive experience of placing implants. They work with me in practice, so they're all brought to speed and trained by me personally. They know what should be happening, and their level of knowledge is way in excess of what you would typically get. The reception staff are also fully clued up to the processes and the administrative methods that we have to go through to line up the patient's appointments with the dentist. The supervision is carried out by very experienced dentists. They're all personally selected by me. They've all got extensive experience of implants over a number of years. Many of them have already had a lot of experience in training already. We tailor or adjust the amount of supervision to suit the abilities of the dentist and the experience of the dentist. So typically by the end of the course, towards the last day, there would actually be very little supervision required, because by that stage the dentist will have gained the necessary knowledge. If somebody has a particular weak area, sometimes, for example, they don't know how to raise a flap, then we can pay particular attention to that with the teaching ratios that we have, typically 1:3 or 1:4. We can take people on one side and actually give them a specific tutorial on an area if they want something that's clearing up, and that's all part of what we do. It is all based on treating patients, so problem-based teaching. So the patients are treated by the dentist, and in real life, in real time, we deal with the situations that arise as a result of that. The success that we had to date has been phenomenal. The feedback that we get from the dentists has all been very positive. One of the problems we do have is we have to put extra days on because people want to come back and do more. A typical comment is that it's the best course they've ever done. So encouraged by the success of this, we plan to expand and open in different sites in different parts of the country. Initially we'll be opening in Bristol, then in London, and then possibly in the north of England or in Scotland, and maybe in Northern Ireland in the long run.